So how are we doing this?
Microphone is at the front of the room.
Oh, okay. Someone wants to, somebody asked me something. What about the poor? Ask me something. See if it's on. There's a switch on the mic itself. That's probably it.
Can you hear me?
Okay. There it is.
All right.
Okay.
Thanks very much for that. I appreciate it. Before Obamacare was voted in, I put up a website called doctorsvote.com in an effort to let the doctors answer 7 unambiguous questions in the hopes that their responses would generate some kind of movement to oppose it. And the results were very interesting, as you can imagine, of the doctors that were responding. And I qualified every one of them. I made sure they were really doctors and didn't, I filtered the list pretty good. And less than 15% would advise their sons or daughters to go into medicine, number one. I asked if it passes, will you leave the practice or significantly alter your practice? And 75% said yes. And in fact, my own doctor quit Medicare 4 years ago, and he's now a concierge practitioner. And other similar results. But what really surprised me was that there was such a lack of outrage in the medical profession. And I don't know whether to attribute that to altruism that they've been inundated with, like everybody else, throughout their education, or what the reason is. And in fact, going back to September '09 at the Washington March, which was centrally focused on Obamacare, there was very few doctors there. Do you have an opinion on
Can
why?
I just ask you a question? Do you know about how many responded to your survey total?
I don't.
Okay, that's all right.
But it was triple digits. It was not 1,000, but it was not 1 or 2.
Okay.
And after Obamacare, I shut it down. But that's what surprised me, was that I thought that there would be such a vocal organization come together like the Tea Party, but in the medical practice, and it didn't happen. The doctors who recognize what's coming, who say that they'll either quit, change, they won't advise their offspring to join the practice, but yet they didn't take significant action. There's a few, splinter organizations that are not really well organized to oppose it, but they're doing what they can, but for the larger part, there's no significant opposition.
I can tell you what I found on this. There's really 2 parts to your observation. The first is why so many doctors would urge their children, offspring, or other young people not to go into medicine. And the other is the why they're not more significantly outraged about this, why we don't see doctors marching in the streets. The second one, for the second part, why isn't there more outrage among the doctors? For all my give and take with them, including my sitting on the Duke University Medical Center ethics panel, as an outside advisor or observer, you're right. I've seen very little actual outrage among the doctors. There's been a few. A little bit of it. I went in for a procedure one day, and I spoke to the anesthesiologist at length, and he left and said, okay, I'll see you at the other end. And then he came back a couple of minutes later, while I was still in the prep room, and he said, I just found out about you. You're defending doctors' rights all over the place. Thank you very much. But that is the only time that's ever happened. With one other exception, I got one of my doctors out off-site to have coffee, and I brought up exactly those issues. Why did she think it was? And why the lack of outrage? One, doctors are just incredibly busy. She said to one of them, did you notice the vote last night in the House of Representatives? And he said, no, I didn't. I was reading patient charts until 2 o'clock in the morning on my living room floor. They're very, very busy. Some of them are in a state of denial. They don't think it can be that bad. They fall for the same trap that many Americans can fall for, which is that you guys have always said the sky is going to fall in. When Social Security was passed, you said it would be the end of the country. It wasn't the end of the country. They're just in denial that it was, and then denial, I think, is a very broad term, wider than evasion. Some of them just deny, that it's happening because they don't have the facts. In other cases, they know the facts but are actively evading it. But they don't want to accept the implications, I think, of what this would mean, which is that their actual practice is in danger. And this leads to the third part of this, which is that they can connect this, if you have this kind of conversation with them, they can connect it to their own practice. But it's hard for them to see it as a systemic problem. And add to this the fact that many doctors, especially at major research institutions, are getting millions of dollars in federal funding. You know, Duke University has gotten hundreds of millions of dollars in federal funding for various things. And doctors are in the middle of that. So they're trapped themselves in an ethical bind. You can see the moral hazard spreading. Moral hazard meaning I do something, advocate something here, and it creates a situation that rewards immoral behavior in other areas, induces people to be immoral. So this is some of the reason why doctors, I think, have not rallied behind this. In many ways, it's their very virtues that hamstring them. Because the virtue is what? A reality focus on their careers, on their life's work, on these diseases, on their patients. And that focus on that means they're not focused on these other issues. So in a certain sense, that plays against them. Now, when it comes to advising people to go into medicine, now here's where we see the concrete results coming clear. Many of them, I think, look at their own lives and say, geez, I haven't had a vacation in 5 years. I'll give you an idea of the dedication of these doctors. I had a young lady doctor who was on the surgical team when I was in the hospital for almost 3 weeks last year. And in the middle of this, I had several crises. Both my lungs collapsed and all this kind of stuff. She was there every day at 6 in the morning, between 6 and 6:15, and 9 o'clock every night, between 9 and 9:15, every day. With one exception, she missed a day. So the next day she came in at 6 in the morning, and I said in my wonderful, benevolent, welcoming self, where the hell were you yesterday? She said, I got married. I said, are you serious? And she said, yes. And I said, I hope you are taking a honeymoon. I really mean it. I am dead serious. I hope you are. She said, yes. My husband's a doctor too, so we'll be taking it next month. That's the degree of dedication that they have. So they see this life for themselves, and then they see the encroachments on it. In many cases, they see the encroachments of insurance companies, which are largely driven in many cases by government policy, and they attribute it to the insurance companies themselves, and they're confused. And they say, I wouldn't recommend this life to anyone else. Who would, right? With that kind of focus, that kind of commitment, and the result is to be told that by the President of the United States that you might take some kids' tonsils out because you're making more money than treating them properly. You know, what kind of deeper insult could possibly be given to a doctor? Especially the doctors who work for organizations who say, I'm on a salary, I don't get any more money by taking out tonsils, right? So I think that's part of the reason why they urge others not to go into it. It's a very, very dedicated, very, very difficult life of all the conscientious doctors I know, especially the researchers who have to research, teach, and do their practices, and they're unable to recommend it, and government medicine is making it worse and worse. So, okay, go ahead.
Well, I have a question, but I'll also make a remark in defense of doctors, since I'm a doctor.
Yeah, please.
And
I want to know what you think.
Well, there are organizations, even though doctors may not be doing this individually organized, there are organizations we belong to.
Mm-hmm.
In Illinois, there's the Illinois State Medical Society,
Okay.
which comes out with an email almost daily about calling your congressman, your representative to do certain things.
Mm-hmm.
So even today, there's a bill that's coming in Thursday morning
Okay.
in Springfield that will take doctors' privileges of practicing outside of a PPO. A PPO is an
Okay.
organization you can join as a doctor, and you have to accept what they pay for whatever the service is. But up until now, a doctor doesn't have to belong to a PPO.
Okay.
And most of these PPOs will then pay perhaps a little more to the doctor that's out of network, that's in network. This bill that's coming in will come in and state if you don't belong to the PPO, we're going to pay you a lot less than the doctors in the PPO, and you can't balance bill. You can't send the patient a bill for what the service is that we don't pay for you. So even as of today, I'm writing to my congressman and doing something. So there are doctors that are doing this.
Oh, yes,
This is
please
going
don't
on.
think that there aren't, but the question is, do you see a groundswell?
Okay, but that's,
Yeah.
my question has to do with something I saw on the internet several months ago. And the question is whether it's true or not, or whether you've heard about it, because it sounds like you read a lot about the Obamacare bill. But this statement came from a doctor in Ann Arbor who appeared before Congress, and it had to do with something that was in the stimulus package that had to do with health care. And I don't know if you've read what was in the stimulus
Not
package
all of
about
it.
health care,
Not all of it.
but this had to do with the doctor asking the congressman that it stated in the stimulus bill that if I see a patient and I come up with a particular diagnosis, that I then have to click some little device that I'm carrying with that diagnosis that is then going to Washington, and some bureaucrat is then going to tell me, for that diagnosis, for this patient at this age, I can order this test, and this test. And that apparently was in the bill, and the doctor says to the Congress people, based on my experience, what if I don't agree with that?
Yeah.
You know, that I feel that instead of that test, I should do this test and this test for the benefit of my patient. And the congressman said, well, we'll fine you. So he says, you're gonna pay me $40 for examining this patient for an hour, and then you're gonna fine me $100? He says, no, we're gonna fine you $100,000. And then he says, well, what if the next patient I see a half hour later has another diagnosis that I don't agree with? Are you gonna then fine me another $100,000? And the congressman says, no, then we're gonna put you in jail.
Right.
So I don't know if this is true or if it's, but that's the question.
Well, it fits I can't verify those particular examples, but it sure fits the full theory and practice and spirit of Obamacare. You know, when Clinton's package came forth in the early 90s, she was asked about the passage about jailing doctors, and she denied that it was in there, and it was in there. You know, we have to remember that for these bills in general, the essential purpose of these bills is not to lay out firmly and clearly what it is we're all supposed to be doing. If it did that, if these bills did that, and you should think with 2,700 pages of Obamacare plus amendments that they'd have the space to do that, but they don't. It's not enough. If they did that, that would be bad, but it wouldn't be the worst thing. These bills are much worse than that, because what these bills do is empower an unelected, unconfirmed, unvetted, appointed bureaucracy to write all these regulations. Now, I have a friend who's an economist who looked at several such bills before Obamacare and looked at the number of pages in the bill and then the corresponding regulations. And he found that on average, it went 10 pages of regulation to every page in the bill. With Obamacare, because it specifically says the secretary shall determine this, secretary shall determine that, we should expect that to be a minimum. So remember, you have 2,700 pages of Obamacare. You probably got another 30,000 pages of regulations to come out. Think of 60 500-page books, right, lined up with the regulations involved. Because the essence of the bill is not to tell us firmly and clearly what we are to do. The essence of the bill is to empower bureaucrats with the power, the ability to use physical force, and government is force, to enact their whims as they see fit. And that's why these bills are the essence of tyranny. It is not true that a tyrant passes strong laws and enforces them ruthlessly, clearly, and objectively. That could be bad, but at least you'd know what was illegal and what was illegal. The essence of tyranny is for the tyrant to change his mind whenever he wants. Right? Oh, I like you, so jaywalking is, get out of here. But I don't like you. Too many cases of jaywalking today, death. You know, that's the essence of tyranny. The essence of tyranny is the introduction of whim and the utter non-objectivity to the process. And that's what these bills do. And that's what's so heinous about the Secretary shall determine passages, because it empowers these bureaucrats. And I will add that although this is an area for constitutional scholars, not for me, and for legal experts, in talking to them and in looking myself, this is a layman's opinion, it appears that the entire administrative state is unconstitutional. Because the Constitution does not empower the legislature to delegate its powers to others to write laws. That's not in the Constitution. So, but it just goes to show how far we've gone, that these bills can now, empower exactly that in a new fourth branch of government called the administrative state, which is bigger than the other three outside the military, and has its own powers, its own courts, its own enforcement terms, and its own enforcement powers. When you look at Obamacare and you realize, I was reading it, page after pages, this section amends the Internal Revenue Code. This section amends the Internal Revenue Code over and over and over and over and over again. And I drew the conclusion, perfectly proper conclusion, that the main enforcement arm of Obamacare will be the IRS. It has the right now to audit every American to determine whether or not you have the proper health care. And one conservative group put forth the estimation that this would require adding some 16,000 federal agents to IRS rolls. And the IRS didn't deny it, they just said, we don't know how many we're going to add yet. And there's the whim again, right? The essence of tyranny. So, okay.
John, I have two questions from the web.
Very good.
First question is this, and you touched on this earlier. The first question is, do insurance companies, like government officials, stifle doctors' decisions?
Okay, is that the first question?
That's the first question.
Let's leave it at that, then we'll do the
Okay.
second. Well, I think you'd have to ask doctors and look at what they're doing. I think that in some cases, insurance companies do say, we will cover this and not cover that. I know myself, when I wanted to get an MRI outside of Duke's plan, Duke said, this is not a participating facility and we won't pay for it. I want to get a second opinion. So I said, okay. I stood at the front desk and I argued with the person in the $2,000 MRI. It turns out cost about $650. So I got it done and I paid them. Now I don't know what is so terrible about that. You do it at Walmart when you shop for the best prices. You would do it in getting your car fixed. In fact, I needed some inner ear shots along with this MRI, and the total bill for the two list price was about $4,000, and insurance would cover neither. So you could say that the insurance company is stifling the doctor's decisions, but only if you adopt the view that the patient somehow deserves and is due whatever bill gets submitted to them without regard to their contract with the insurance company. So once the inner ear shots were negotiated, the price of the two treatments, the MRI plus the shots, fell to under $1,400. So I made arrangements to pay it. Oh my God, this is terrible. What about people who don't have $1,400? Well, I got the air conditioning fixed on my car, which seized one day I drove to Washington to see Lynn, and on the way home, the air conditioning seized on my car. I had to get it fixed. $1,400 to fix the air conditioner in my car, right? So why didn't my car go in the ditch? I end up, right? You negotiate it and you pay it. So it's only on the premise of need, only on the premise that the purpose of an insurance company is to pay any bill that comes its way, regardless of contract, could we say that the insurance companies are stifling doctors' decisions. It's also important not to take such a question outside of context, because you'd have to ask the question, why is it, for example, that 2 weeks worth of oral chemotherapy pills for me, which I was on this time last summer, 2 weeks worth, are $5,000. Why were they $4,900 for 2 weeks worth of these pills, 7 pills, 98 pills, right, over 2 weeks? And of course, I looked at it and I found out that the drug was delayed by the FDA for years, that the drug company had hundreds of millions of dollars invested in this, and their investment capital had to just sit there for years while the drug was approved. And the drug was approved, then they have to gain that money back. So I simply say to my students, suppose we had a federal department of software, and it was their job to determine what operating systems for computers are appropriate to release. What would be happening? Well, they would be reviewing Windows Vista right about now. We'd be using Windows 3.1. Windows 7 would be on some engineer's desk, and Microsoft would be going through the 3 to 5 years necessary to put the paperwork together to get approval for the software. And by the way, when it did come out, it would cost about $2,000. So that is the kind of context I think that we have to keep in mind for all of this. I think insurance companies do, in many ways, inhibit what doctors do, but it is because the costs have been driven so artificially high, and because there's no easy means for people to say, and people aren't willing to say, yeah, I'll absorb that cost. You wouldn't buy a car with a dent, then buy car insurance and expect the car insurance company to cover the dent. But what else does it mean to say we're going to cover, pre-existing conditions? If your insurance, if you did like I did and you dropped the collision coverage on your car because it's a 9-year-old bomb, well, it's a Jeep Liberty and I can't trade my Liberty for anything because I'm stuck with it. And it gets smacked into. I didn't write a letter in the paper and scream and complain to my congressman because it's going to cost $2,000 to fix. I recognized that the contract with the insurance company said they weren't responsible, so I made arrangements to do it myself. I knew that going in. So what we need here is for government to do its proper job, which is clear enforcement of contracts, not telling people what should be in the contracts. So the prices can get back to normal and so that people can adopt the proper attitude to these things. So, second question from the web.
Second question from the web is, do you have any thoughts about tort reform?
Oh, tort reform. Changed my mind on this a lot, thanks to some conversations with Lynn going back several years. Some doctors had made it sound to me like this was a central issue. And it's an important one. It is an important one. Average insurance bill for many medical specialties in certain areas of the country can run $300,000 a year. Think about $1,000 a day, to insure a specialist doctor against these kind of lawsuits. So certainly tort reform is necessary. But I've come to think it's not central to healthcare reform, that it is something that would flow naturally from the government's proper adjudication of contracts. I do think that there's an entire problem much wider than medicine in a court system that empowers a jury to levy punitive damages or other damages of millions of dollars. I mean, the best one that sticks to my mind was several years ago, a case in a southern state of a company that put a dish, one of these television receivers, on top of somebody's roof, and the roof leaked. And the people said, get that thing off there. And the company came back and took the thing off, patched the roof professionally, and the roof never leaked anymore. And they sued. And the jury awarded them something like $1 billion. I mean, not exaggerating. There's something wrong with the court system that lets that happen. But it's far broader than medicine, and I don't think is the central issue in all this. It's important, and proper healthcare reform should address it, but it would probably be number 4 on the list, of 4 or 5 on the list of things to be fixed. Go ahead, please.
I think most Americans would support your views on Obamacare in that they do see it as an assault on freedom. They want to have the right to choose their own doctor, choose their own insurance company. They don't want the government coming in between the doctor and them when they're making decisions. But I'm going to challenge you a little bit and see how you can make those arguments against Medicare, because we don't have a free market healthcare system now. We have, I have a healthcare background, and basically Medicare sets rules for everything a hospital can do, whether it's a Medicare patient or not. So how do you think you make the argument against Medicare? Because most Americans are pretty happy with it.
Yes, most Americans are happy with Medicare. Thank you. That's a very, very good question. And the one obvious, my father is very happy with his insurance. He has told me he has Medicare and a combination of supplemental, which is pretty inexpensive for him. All right? But again, I think people have to hold the full context of this, and we have to challenge the idea that need is a claim. Medicare is not free. Somebody is paying for it, right? And it's being paid for either by, and there's only 3 ways the government can pay for anything, and it always reduces down to taking it from the producers: by direct taxation, by borrowing, which just defers the payments into the future, or by printing money, which is inflation. So people need to understand that Medicare is not free. Somebody is paying for it. And do they understand that Medicare is also not a voluntary program? You hit 65, it's impossible to escape it. And there's a certain principle at stake that a government program doesn't have to outlaw a competing system. All it has to do is compete with it. Because it has unlimited money from taxpayers, can undercut the market, it can therefore drive out any business that it wants to drive out. So President Obama can stand up and lie to the nation and say, under this bill, you can keep your plan. Sure, he's right. The plan the Obamacare plan didn't outlaw the other plans. It just made them financially unfeasible, so they'd be driven out of business. And of course, what will happen is the insurance companies will go out of business, drop the coverage, and then people will say, thank God the government is here to save us. Confusing cause and effect. In challenging Medicare, ultimately, I don't think there's any way around challenging where its revenues come from, which is enforced taxation in one form or another, the degree of influence it has on the healthcare system of the country, which is driving prices up, and for people to understand there is no free market in healthcare. There hasn't been since the 60s at least, and probably not even before that. That right now the federal government controls in the neighborhood, directly pays out in the neighborhood of 50 cents on every healthcare dollar in the country. Before Obamacare was 47 cents, so it's probably higher now, and directly controls 65 to 70%. I don't think there's any way to really confront Medicare without confronting those issues. But the first, foremost, and primary issue that has to be confronted is because you need it doesn't mean you have a claim on others. If you claim you need Medicare and therefore others must pay for it, then I'm going to claim I need a new bumper for my car and others should pay for that. And don't tell me it's not a necessity because without a car I can't get to work, can't get to the food store, and won't be able to live. So we've got to challenge the idea that need is a claim. And from that, all the other ancillary parts of this that connect to it, I don't see any easy way to do this. The fact that most people are happy with it, by the way, also shows how insidious these programs are. Once they're put in place, people get used to them. And they begin to think it's impossible to have a world without them. If I were in government, just an aside, on a national level, I don't believe myself that we can solve America's budget problems by cutting 10% across the board or 5% across the board from all these different programs, by cutting them all. Yes, 5, 10, 15% even. I don't think that can be done that way. I think you have to eliminate whole programs. It's the only way you're going to do it. So the first one I'd go after would be energy. Why energy? Well, it's not quite as close to home as education. It's a good entry-level issue to get people to understand. And you can also point to its utter failure very, very easily. It was formed when? As I ask students that, and they'll say, oh, I don't know, 1920s, No, 1970s, under the Republican Nixon. And what was the purpose of the Energy Department? To get us off foreign oil. Well, at the point of phrase, how's that working out for you, right? And so you can get them to understand the utter failure of this and get them perhaps to conceive a world without the Education Department. And then you can start going after the others. And you can ask them, when was the Education Department formed? 1979, I think, under Carter. Blatant payoff to the teachers' unions. And how do you think the state of education goes since 1979 versus before 1979? In other words, how's that working out for you, right? And the students come in now, have less real education than they did before the formation of the Education Department. So you get them to see that we lived life, in many cases better, without these programs, without these whole departments. And I think Medicare is one we'd have to get to after we establish that principle for others. But it's perhaps the most difficult one of all because you have to confront the idea that need is a claim. That someone's need is a claim. And that we owe it to old people to give them this. And that they're actually better off with it. So please.
I'm probably one of the people you're ranting against here. I have a Medicare
HMO Advantage plan, and I have a primary care physician, and I have kind of like a medical home. She chooses the
Sure.
specialists and so on, and I think I'm well served. I don't pay any premium, and now I even get my prescription drugs free because I use generics.
Right.
Now, my concern about the Obama plan, it seems like, or any of these plans, is that no one's really worried about the cost. I mean, medical costs are just going up very, very much, inflated. At least there are doctors who won't take Medicare patients just because they want to charge more. So who's gonna put keep these costs down or get more? I mean, like this, having a Medicare home is supposed to be more efficient. The Humana HMO at least is trying to use preventative medicine to anticipate and get people to live more healthy lifestyles and so on, and reduce these costs, because this is the problem. No one seems to be worried about how we're going to control these.
But the costs are, no, thank you for that. I appreciate the challenge, because these are things we have to think about these things.
Yeah.
It would be, I think, wrong to just cut off Medicare, cut off Social Security to people who are 75 years old, right? They've paid 50 years into the system, right? It's something that has to be phased out if we're going to get rid of it, and it would take a generation to do that. You start with people 30 years old and say, forget it.
Yeah.
After this, you start with people 40 years old, you say, you know what, you forget it too. And after that, a phased step down. But consider the nature of the problem. I want to confirm this. You said you don't pay any premiums, basically. Basically, the whole thing is free. Well, multiply that times 60 million Americans.
Yeah.
What would anyone think was going to happen with the costs? Right? Ultimately, in terms of supply and demand economically, what they're doing is throwing unlimited money at the demand, which causes prices to go through the ceiling. And, ultimately, I would ask someone, do you think you deserve this health care at no cost? And if the person says yes, now I was on a BBC radio program a while back. It's probably the time I reached the greatest audience of my life. There was something like 25 million listeners worldwide. And there was a guy in there who was screaming that he had a right to a free operation. And it wasn't even a life-threatening operation. It was to fix a bad knee in New York. And he said right out, I had an operation 10 years ago, but needs to be redone now. And the operation 10 years ago was for free too, right? So he's screaming and ranting that he wants this. And the announcer cut in and said, we only have 15 seconds left. So I have a question, and the question was to him. Do you think other people should pay for your new knee? That was the question. Boy, I'll tell you what, I was really impressed, because there's no better question I could think of. In 15 seconds, what would you ask? Do you think other people should pay for your knee? And he went, yes. Right? Because he had to confront the issue, So ultimately, other people are paying for your medical care. The issue of costs is, I think, actually self-evident as to why they would go through the ceiling. If everybody was told they can get free brake pads for their cars every 20,000 miles, the whole industry, would develop, to maneuver around this and to get all the free brake pads they could. Cause the brake pads would go through the ceiling, and that would be a natural economic result. But again, I maintain the real issue that has to be confronted is on a moral level. Do you really think that you deserve that health care for free? And one of the bad things about the present system is it puts people in a position where they can't say no, that makes them dependent on that. And I understand, and dependence can be real, And that is, I think, why it requires a confrontation of the issue on a moral level and a phase-out. Please.
Yes, I'd like to make a couple suggestions for
Please.
the next series of talks. I think the idea you developed the idea of values achievement. I think that ought to be a talk that contrasts that with values wishing,
Okay.
which I see an awful lot of.
That's a good point.
And I think, I would make a point that human emotional and psychological makeup evolved in hunter-gatherer groups, which are basically run by fiat. And I think that's what people are trying to, you talk about all this modern socialism and everything, but that's basically they're trying to run complex industrial societies as if they were a hunter-gatherer band.
I think that's, I think you've got two very, very good suggestions there.
And as far as whims or bureaucratic regulations are concerned, I was in a law library several years ago, and I measured the thickness of the two volumes of the Title 26 of the United States Code, that's Internal Revenue Code. I measured that at about 4 inches. And then I measured the regulations to Title 26, which are a little paperback. That was 20, on the law library shelf, was something like 22 inches.
Okay.
So,
Well, there you have 6 times as many regulations as the law. Sure. I mean, several good observations here. You want me to come back, or do you want to? I can.
Sometimes I forget what yeah, well, we have I go to, generally on Saturday nights, I go to the College of Complexes,
Okay.
which is where I see a lot of this whim.
Oh, in the ecology movement?
No, the College of Complexes, it meets every
College of
Saturday.
Complexes, okay.
Meets every Saturday night.
Okay,
There's a College of Complexes website,
okay.
which I guess you can get on Chapel Hill as well as here. It was supposed to have been the most popular website in Australia some years ago. But
Well, let me,
we have a bunch of leftists there that just are, they're trying to run everything like it was a, they're into values wishing.
let me add a couple, those are good observations. Let me add 2 to them. First off, the idea that things are all run by fiat is what I call the authoritarian premise. And it's the idea that nothing will get done if it's not dictated from the top down. It's a denial of what some have called spontaneous order, where markets straighten a lot of these things out for themselves. Market meaning individuals trading and making value judgments, okay, on an aggregate level. On the issue of values versus whims, something I should have noted in the talk, which I'll note here. What is Ayn Rand's definition of a value? It is that which one acts to gain and or keep. So not only is action part of the concept of life, and also in the principles of individual rights, it's also at the intermediate moral step. The achievement of values is an action. A value is that which one acts to gain and or keep. So if I sit here and I think, gee, I'd like a new Mustang convertible. A few months ago I was thinking that way because I was thinking, I need to buy myself something nice. And I decided not to buy that. Well, the fact that I decided not to buy it means it was not a value to me at the cost it would be, because I did not act to gain it. I could say it'd be nice to have a red Mustang convertible. If anyone wants to give me one, I'll use it every few weeks or so, drive around town, right? But it wasn't a value to me, because a value is that which one acts to gain and or keep. So on the level of life, life is a process of self-sustaining, self-generated action. On the moral level, values are that which one acts to gain and or keep. And on the political level, individual rights are the rights to act, the right to life, liberty, and the pursuit of happiness. So that's really my answer to that. I don't know where Lynn went, but we're out of time, so thank you.